Good afternoon, everyone. Welcome. I would like to remind you that this conference is being recorded. At the moment, all participants are only in listening mode. For those that are connected by telephone and require operator assistance, please dial *0. For those online that require assistance, please use the chat box on your screen. I would like to hand the meeting over to your host. Thank you. Hello, everyone. We are very pleased that so many of you could join us today. I'm Jean-Michel Mercier. I am Program Manager at MHCC, and I'll be moderating today's presentation. A few important points. First, you'll notice that there are currently two different slides on your screen. On the left is the presentation in French, and on the right is the presentation in English. Depending on the size of your screen, the information on some of the slides during the presentation may be difficult to read. It's therefore recommended that you choose the language you prefer and to make these slides full screen. You can do this by clicking on the 4 diagonal arrows in the upper right corner of the presentation. It's the full screen button. You should note, however, that by doing this, you will lose the chat box. You'll therefore have to return to normal view if you want to ask questions. To return to normal view, please click on the same 4 diagonal arrows in the top right corner of the presentation. Exit full screen. If you prefer seeing both presentations, you can also download the links for the program we'll be presenting in the chat box. Information that will be difficult to see on the slides is also available in the program. So you can download the program and view the information more easily that way. If you have any questions, please feel free to ask them in English or in French directly in the chat box at any time during the presentation. However, due to the large number of participants on this call, questions will only be answered at the very end of the presentation. If you have any technical problems, please don't hesitate to let us know, and we'll do our best to help you. Please do so in the chat box. And finally, considering the subject matter today, I invite you to take down the number of the crisis line in your area, and please contact them if you need help. Without further ado, our speaker for today's presentation is the co-author of the Postvention program. She's the professor of at the Department of Psychoeducation and Psychology at Université du Québec en Outaouais, researcher with the McGill Group for the Study of Suicide, and a member of the Quebec Research Network on Suicide. I'm very happy that she is here with us, and I'll hand the floor over to Dr. Monique Seguin. Thank you, and welcome to today's webinar to all of you. I'm sorry, I have some feedback on my end. I'm hoping that we can deal with that. First of all, I'd like to thank MHCC and Jean-Michel Mercier, his technical team as well, for planning this webinar. So the program being prepared to act in the event of suicide was prepared with my colleagues Françoise Roy and Tania Boilard. The program was developed after a long process, including 4 steps. The first step was to meet people who had already implemented postvention programs. We wanted to know what worked well and what could have been improved. And then we did a literature review of more than 400 papers that we reviewed in order to see what the best practices were. And then we looked at existing programs, and we identified all actions that were recommended in these programs. So we drafted a list of those actions that we then submitted to an expert committee that determined if each of these actions was indeed beneficial. And then we put these actions in a specific measure that allowed us to create the current program. We then distributed the program, its contents, to about 30 people, and thanks to their input, we came up with the program I'll be presenting today. Again, thank you very much to my colleagues, Françoise Roy and Tania Boilard, for their input. Today's presentation will answer 3 questions. Why implement a postvention program following a suicide? Do these programs have to be specific when there's a death by suicide, or does any traumatic event benefit from that type of program? So, for whom and why should we implement such a program? And third question, how do you implement such a program? So with respect to the first question, why should you implement a postvention program? Because generally, death by suicide can produce an impact on the area, on the individuals that are part of this area, or that are beyond the direct area. And some people are more vulnerable on an individual basis and can be more shaken by the impact this has on the community and will be more likely to reproduce a suicidal gesture. So the impact on the community, you have to understand that when there's a death by suicide in a community, the death in itself can create disorganization within the community, and it can happen overnight in some areas. It can create confusion as to what happened. Did we know? Did we not know? What did we know? And this can, in fact, paralyze day-to-day activities. And it can also bring about tension and conflict between some individuals in the community. And some may be looking for guilty parties. So overall, it can have a really important impact on the community. That's why when we'll talk about implementing the program, we'll have very specific measures to contain the community, to try and bring the community back to more stability in order for this community to be able to feel protective to its individuals. And death by suicide can also have an impact on the individuals. Now, we certainly can't think that because there is a death by suicide that all individuals will be affected. Obviously, this can depend on the type of community. In this case, we're talking about death by suicide, for instance, in a school. So there may be a lot of differences if the school is a small school, a neighborhood school where there are 200 or 300 children, if there are students who are in a specific program for athletics, for instance, where they know each other very well, travel together, and have done so for 4 or 5 years, versus a very large school of 5, 6, 7, 8,000 students where there are many campuses, and where all students don't know each other and may not all be aware of what's happening on the campus. So vulnerability is individual. It's not a populational factor. The impact on the community, however, is populational. However, vulnerability is always individual. And this is something that needs to be assessed based on each individual and not necessarily based on what we believe everyone will be experiencing because this event has occurred. So we'll come back to the program measures a little bit later. So how to assess, who to assess, and why. And now where they meet. And this is probably the reason why a postvention program following a suicide is specific, because other events, for instance, an accident, disease, or even a terrorist attack, we don't necessarily have the same fears of copycat behavior. Now, perhaps for terrorism, it may be the case, but generally we don't expect disease or accidents to reoccur. However, when there is a death by suicide in the school, there can be a ripple effect, there can be a knock-on effect, and it's quite well documented. It's starting to be documented in the literature as well. And some research papers indicate that 50% of youth that are exposed to a suicide are 2 to 4 times more likely than the general population to attempt to commit suicide, to think about suicide, and so on and so forth. We also say that 1 to 4% of teenage suicides occur following the suicide of a close family member, a friend, or a cluster of suicides. So this is why we try to avoid copycat behavior, especially during teenage years, because teenage years are moments when people are looking for their identity. And during this process, youth tend to identify with their peers, and it's very important for them. So the process of finding one's identity means that if one identifies with the deceased, can lead some people that are already vulnerable to think of suicide more and more. And that's the reason why it's very important to have a postvention program after a suicide. Now, that said, other programs we're having a technical issue. There's an echo, and we're just asking the speaker if she could possibly turn off the speakers on her computer. And it appears that we've solved the problem. I'm very sorry, says Monique Seguin. I'm very sorry. I'll carry on. Now, this is why it's very important to introduce a program after a suicide, because we need to avoid copycat behavior. Of course, this can take other forms in case of traumatic events, but it's very well documented in the case of suicide. That's why when there's youth, it's very important to try and prevent that type of knock-on effect. It can happen in adult environments. However, during adolescent years, it's even more important because teenagers tend to identify very closely to their peers. That's why this type of program is very important. Now, our second question was, when we introduce that kind of program, for whom are we introducing it, and to do what? To achieve what goal? So this brings us back to individual differences. The individuals in a single community will not all act the same way. So that's why we try and find subgroups. Generally, we identify 3 larger subgroups. Firstly, the first subgroup are those individuals that are directly affected by the event. In this case, there's the bereaved individuals. So in the environment are their brothers, sisters, close family members, or friends that may not be aware or that may experience different reactions from the other group because they will experience bereavement. And then are there individuals who were directly exposed to the suicide? Were there witnesses? They obviously will have to be found very quickly because we certainly want to make sure that we screen them so that they don't develop a post-traumatic stress event or behavior. So we'll try to identify those groups as quickly as possible. Now, for instance, when you throw a stone into a lake, it creates ripples. Some circles are closer to the stone. Group 1 is that first circle, a circle of individuals that are most directly affected by the event. Then, the second group is vulnerable individuals. These are people in the community that may not have known the deceased, but who already have vulnerability. They already have some factors, risk factors, and they may identify with the deceased. The disorganization in the community can lead them to receive less support, to have less access to their regular networks, and this may increase their vulnerability. And if their vulnerability increases, and if they experience other events, they may themselves find themselves in a crisis reaction or exhibit a suicidal ideation or behavior. The third group is the population at large. Now, obviously, the population at large is not necessarily at risk. However, it can potentially be affected by the death by suicide in the community at a different level. In the population, we don't know how each individual evolves. Some individuals will maintain their stability, whereas others may develop throughout the academic year, for instance, new vulnerabilities that are due to other things. Given that there was a suicide in the school, for instance, the suicide in the school can be a reminder of what can happen. So we're faced with 3 different groups, and it's very important to acknowledge that we can't treat them all the same. We need to adapt care based on these subgroups. So the subgroups, the first subgroup, group number 1, requires targeted interventions. The targeted interventions are done quickly and are adapted to each of the bereaved individuals or to those people that were, for instance, direct witnesses of the event. Then, for the second group, we'll be looking at developing interventions that are more selective, for instance, at screening, and interventions that will help reduce risk factors. Try to find better strategies to ensure that the vulnerable individuals do not become at risk. And as far as the third group, the population at large, what's really important, what research demonstrates, is that we need to increase the capacity for screening, for self-identifying, for new strategies for support. The more the environment is resilient, the more the community will be able to put up with difficult situations, and its individuals, its members, will be able to support each other. So these are the types of interventions based on the group, and as you can see, it's a pyramid, and the portion in red, the peak, represents a much smaller number of individuals than the second and third portions of the pyramid. The bottom portion is larger and represents the population at large. So essentially, interventions have to be adapted based on the subgroups. But at the same time, we can't provide the same intervention to everyone. So we can't have one-size-fits-all approach. Scientific research demonstrates this. Some interventions are not effective and are not recommended to some subgroups. And we'll come back to this later once we look at the implementation of the program. But essentially what you need to see here is that there is a very small population of people who are bereaved and people that may have been a witness to the death by suicide. There's a certain number of individuals who are vulnerable. They're not always easily identified in a school context. However, eventually they have to be screened. And then there's the whole of the population. So we really have to think about these subgroups, and we have to plan our interventions based on those three subgroups. So when we're looking at interventions, many programs were limited in time. They intervened a lot, but for a very short period of time, and that's not necessarily effective. In this kind of program, we're looking at many types of interventions that are offered sometimes simultaneously and sometimes sequentially. However, we have to look at them in the long run because the development of problems, the individual impact of a suicide can be harder to stabilize than the initial impact on the community. And when support is short-term, we can stabilize the community, the environment, but it's not sufficient to ensure that there aren't subsequent problems on an individual basis. So what we suggest is to have 4 sequential phases. And you'll see in a moment why we first look at preparation and why it's so important to prepare. At the time of the event, what must be done and what must be done immediately after the event. And finally, what should we do in the medium and long term? And in many programs, research has shown that it's the fourth part, the medium and long-term follow-up, that are often absent in postvention programs. So overall, I would say that you need many measures. In this case, we have 10. Some of the measures will happen at various moments based on the event and based on the specific case. There are measures that can happen simultaneously. Some will happen over a period, and some will happen over many periods. So what we're looking at here on this slide is 4 phases. Firstly, preparing, then the event, where at the event there can be 3 measures: emergency, communication, and screening, detection of those individuals that may have been a witness to the death by suicide or the bereaved. Then, after the event, analyzing the event, communication, memorials, which involve what happened, and this can happen over a long period of time. Some memorials happen a year later. Then support for first responders. We continue to screen and support those people that we've already screened at the time of the event, so the people that are bereaved and the people that may have been witness to the event, and then we start looking for individuals that are at greater risk. And then in the medium and long term, we need universal measures that affect the entire population to support the community. And then we review our postvention. As you can see here, all 10 measures aim at reducing the impact on the community and the individuals. Some measures are more specific, and they can reduce the impact and contain the community. That's what you can see on the first part of the slide. In the case of a school, measures 1 through 6 and 10 are aimed at stabilizing or containing the community, whereas measures 7, 8, 9, and also 10 are there to screen, identify, and support people who are experiencing individual problems. So you have to be able to do both. However, when we're creating a program, when we're implementing a program like this one, the same individual cannot be in charge of all these measures. That's why we need a team, and that's why we need to be able to prepare to implement this type of program, so that if an event like this one happens, that we're prepared for it. Now, obviously, preparing doesn't mean that that we're looking for this type of event to occur. However, if it does occur, we'll be ready. So the following slides will all show you this in greater depth. For each of the measures, because I'll be dealing with each of the measures more specifically, you'll see that there's a slide for each of the measures. And in fact, you may find it difficult to read the information because, as you'll see, there's a lot on each of the slides, and I apologize for it. It's essentially a screenshot of the program. As Jean-Michel was saying earlier, at the very end of the webinar, you'll be able to download the program and you can see this information more easily. Now, I won't necessarily look at each of the actions. However, I want to show you an overview of the 10 measures so that you can determine what needs to be done. So I told you earlier, actions. Actions, in one of the activities we used to implement the program, we looked at existing programs, we eliminated some of the programs, and we came up with 190 actions that were all different, that we then submitted to an expert committee so that we could land on a consensus, the Delphi method, in order to identify which actions are the most important to implement and which actions are no longer part of best practices, are not necessary, or can even have negative effects. So out of that 190 actions we came up with, the experts we consulted with helped us narrow them down to 128. The 128 actions are found under each of the 10 measures. For each of the measures, there's a list of preparatory tasks. So it's a checklist, if you will, to see if you've prepared that measure appropriately. And then we also have tools that can help support each of the measures. So you'll see in the program, once you download it, that all the tools are in the schedules. And in fact, you'll have access to all of these tools, the tools that we developed during the program. So measure 1. Once again, I'm really sorry because it's very small, but here you can see it's a measure about organization of the community. There are 6 larger steps to organizing the community. And what's important here, there are 6 steps and actions. There are tasks to complete and tools that are suggested. In terms of the preparation itself, what's important is to get buy-in from the community. And the more you look for support and buy-in within the community, the more you look at buy-in not only from your colleagues, but rather the management team, its support staff. That's what's most important. Here's an example of the tools. Winning conditions for implementing measures. And there are tools as well dealing with who does what and how do you design such a program. Now, winning conditions, I want to come back to this because what you need is buy-in and support from management, availability of resources, and in fact, availability of resources has to be forecast ahead of time. For instance, if there's a death by suicide and that in the school there's only one psychologist or one social worker, will we be able to gain support from elsewhere, for instance, from a local health unit or from public services? We need agreements ahead of time to make sure that the support is there when it's required. And we also have to be able to train people ahead of time. Obviously, when an event happens, we have to learn from it, but if we have a minimum of training, if people know what they should do, if they have enough knowledge to look at their community and try to support it, the community should be in a better position to live with the consequences. So what we need to know is who does what. Everyone has a role to play, and generally there is work for everyone. So all of that involves preparing the community. And the more you have winning conditions, the more implementing the program when it needs to be executed will be done easily. Now, the rollout, we have to be able to make sure that the phases are followed sequentially, and also that the program is assessed. A lot of program evaluations point to the fact that interventions are too short. And if they're too short, for instance, if there's support for a week or two, perhaps even 3 weeks, generally the people that were exposed to an event develop signs, symptoms, or post-traumatic stress disorder, for instance, for weeks after an event. And people who are bereaved, the first month, they're in a state of shock. They are disorganized. It's not necessarily the stage at which the bereavement is the hardest. People who develop anxiety won't necessarily develop it in the first week. That's the reason why it's very important to carry on with those activities beyond the first few weeks. So these are the conditions for preparation. Once you're prepared, if an event occurs, you need to turn to emergency measures. Now, in the case of a suicide, the suicide can happen in a school, but often it's not. It happens in the family home, and the school finds out about it. But if the suicide does occur in the school itself, obviously we need emergency measures and protection measures. And now, in this case, there are many steps as well. There are 6 different steps. They're very logical, in fact, that are essentially to call 911, call police, call EMS, and once first responders are there, they will be in charge of the site. And they will look after the institution. However, the institution, the school, needs to at least have a few other measures to protect the staff and students. I'd give you a very quick example. In Quebec, for those of you who are in Quebec, you may remember that there was shooting at Dawson College in September, I believe it was 2006. So my research team and the team that I work with was asked by the Ministry of Health and Social Services a few months after that to assess the Postvention program that was implemented after the Dawson College shooting that affected a great number of people. So we conducted evaluations, and what was interesting is that in the emergency measures, what we noted, for those of you who will remember, it happened early September. There was an active shooter, and students were fleeing. It was very chaotic. There were a great number of emergency vehicles, such as police cars and ambulances, and there was also a CLSC, a crisis center close by. So the CLSC staff put their gear on and went to the college to help the students. Now, the police didn't let them go through. So when we looked at the evaluation after the fact, we were told by the CLSC, the local health unit, that they were ready, that they had the skills, but that they weren't given access to the youth. But the police, when we asked them, said, no, we're there to secure the site. Why would these people want to go past our barriers? So in this kind of situation, there's misalignment of values. And when we met people that were fleeing and that we asked them, what would you have liked at that time? What would you have liked to see? What they wanted was to go home. They wanted to see their parents and their loved ones and feel protected. Eventually, what they wanted was a phone to basically call home. So when the emergency happens, there are very basic needs, but everybody's perception of those needs is different. So we have to adjust to these. And this adjustment, this adaptation, happens during the preparation stage. When an emergency happens, then we need protection measures. We need to comfort people. Is there a place where people can congregate? Are parents aware that they can come get their child? If they're minors, will the right parents come get the right children, and so on and so forth? So we have to look at protection measures more than intervention measures. A psychosocial intervention may not happen exactly at that point in time. We're going to look at protection measures, and you'll start also identifying those individuals that may have been directly affected by the event. That information has to be kept, but generally the psychosocial intervention happens a little bit after the event. Measure 3 now. Now, once emergency services have left, or once we find out that a youth has committed suicide and that other youth come to the school, what should we do? So before we do anything else, we need to analyze the event. So this, what you can see here, this diagram, is the analysis of the event, the measures that you choose to implement, applying these measures, and follow up. This happens in a loop. Initially, it even happens every day with the team. We need to analyze the situation. What should we do? What are the measures we should implement? Did we do it effectively, and what were the results? And we start all over again. So you have to be able to analyze, and in order to assess appropriately, you need to understand the impact of each of the measures. This is the event analysis grid. It's in the schedule of our program, It can also help you at the outset understand how to collect information, and it's on the basis of this information that you'll be able to develop a strategy and determine roles and responsibilities. Who can do what in a concurrent or sequential fashion. Measure 4 is communication. Communication is fundamental because you need to have internal communication, but you need to be able to contain it internally. So what do you say? Is it necessary to say to everyone that it was a suicide? More and more best practices and literature show us that when it's a suicide, it's best to act and say the same things you would say if it were another type of death. So if a child has an accident or cancer and subsequently dies, do we tell everyone? Now, it can depend on the size of the institution. Does everyone know each other? Is it a 5,000 student school? Should it be broadcast widely? Not necessarily. So when you talk about suicide, you have to think about the same things you would think in another form of death. It may be important to talk about the suicide, but certainly not the manner in which the suicide was committed. If you choose to say that it was a suicide, do not say how it happened, because divulging the manner in which the suicide happened has a negative impact and can create copycat behavior and give ideas to people who don't currently have any. So what needs to be said, what doesn't need to be said, how to say it, and who should be the messenger. These are really important questions, and they're really important questions that measures will help you. These measures will help you address. Providing support. Every time you provide information, you need to say where you can find support. The more you provide information with respect to what can help, the support that can be found, it can create a protective effect and reduce copycat behavior. So internal communication is one thing, but then there's also external communication through social media or other media. That's another problem. And we don't always have the best means to communicate in this way. And we know that negative communication or too much media coverage or negative media coverage can have a knock-on effect and copycat behavior. So it's really important to try to contain that, to find strategies, to work on it. Who needs to do it? How? And that's another question. It can depend on the environment. But if an environment finds hate messages, for instance, on social media, then one must be able to intervene and ask police, for instance, to come in. And in the tools, you'll also find suggestions from the WHO on how to act in social media. In terms of memorials, once again, you may choose to have a memorial or not. The question here is to determine how not to stoke fears or emotions and not force a school, an entire school, in a memorial where people don't really understand why they're there and what's happened. More and more, what we're saying is that memorial events should be private than public. That said, I think that we can easily ask students what we should do and how we should do it. If they are involved in the memorial, we may avoid negative effects. For instance, if we ask everyone to leave the school and release balloons, perhaps someone who is intimidated by their peers, someone who's experiencing things at home will think, well, if I died, everybody would release balloons for me. So you can see how an exaggeration such as that so we have to be able to measure the type of memorial that is more appropriate. Support for first responders, this is really important because everybody can be involved. And I'm talking about everybody in the school, whether it's somebody who's a cook in the school, the principal, everybody can be involved and contain the effect and can have a role to play in protecting students. And when there is a death by suicide, the more there are adults to support the youth, the better it is. Measure 7, 8, and 9 have to do with individuals. Measure 7, we're looking for the individuals that are directly bereaved. Are there brothers and sisters or friends in the schools, boyfriend, girlfriend of the individual? It's really important because they will be bereaved. It's not the entire school generally who will be bereaved. It's those individuals who lost a loved one. So those individuals that lost a loved one will need support. Individuals that were exposed, that were witnesses, will also need early intervention. For years, we did debrief events. Debriefings are not recommended. Debriefings are not recommended. I want to underscore this. We do not recommend that groups come together so that everybody discuss their feelings. That increases stress, tension, and disorganization rather than containing those emotions. So we rather need to look for the people that are suffering, and we are looking for individual interventions rather than group interventions. I can see that time is flying by. I'll try to pick up the speed. So in terms of the selective measures, here we're looking for groups. That's a little bit challenging because vulnerable individuals in schools, who are they? Where are they? And in order to identify them, we need to ask staff, the people that work in the school. We need to ask social workers, nurses, psychologists, principals. Who, in your opinion, are those youth that are experiencing difficulties, that are vulnerable, that are, for instance, failing in school, that have been bullied? Who are the students that are most at risk? And without rushing toward them, we can certainly find a way to reach them strategically and make sure they have support. Make sure that their issues aren't amplified, and rather provide support to individuals that may already be experiencing difficult situations. So it's really important because the more we can screen vulnerable individuals, the more we'll prevent problems. And in many programs, in fact, in many programs that were developed in the U.S. after there were shootings in schools, we know that these have happened on numerous occasions in the U.S. So programs were developed after these traumatic events. So for those individuals that were involved in those events, they tended to be known to either a police or to the school. So it's important to identify those people. So the more we help them, the less likely they are to be at risk of acting and of creating more suffering either for themselves or for their environment. And here you have detection and selective interventions, which you can look at if you download the program. Now, in terms of universal interventions, we have, for instance, healthy school programs, well-being programs to prevent bullying. Now, this is not something you need to implement 2 days after the event, but perhaps a few months after the event you can implement this type of program in order to avoid that the environment degrades. So the more the environment is resilient and the more the individuals in the environment learn, the more resilience will build. And now, finally, a review is really important. And in fact, despite existing programs and analysis, there is a lack of evidence. So I would ask you, if you implement a program, please review it. And in fact, I dream of having a website where the communities that implement postvention programs can upload their reviews, anonymized, of course, so that the community at large can benefit from others' experience. And unfortunately, we're not there. However, we can dream. We can dream of that being a development in the future. So thank you very much for your attention. And I think we still have a few minutes. I'll be pleased to answer your questions. Jean-Michel Mercier. Thank you, Dr. Seguin. So as mentioned, we'll be moving on to the question and answer period. Now, we may not be able to answer all your questions. If that's the case, please download the program that's in the chat box. Your question may be, or the answer to your question may be in the program. Otherwise, please send me an email directly. You'll see my email pop up in the chat box, and I will send your question to Dr. Seguin. There have been questions asked about the PowerPoint slides. Will they be available? I just want to confirm that the slides, as well as the recording, will be available in the coming days on the MHCC's site, and the slides will be distributed to the participants. So we have a few minutes. If you have any questions, please don't hesitate. And if some of you need to leave us, then thank you very much for being with us. There's one question from Marie-Claire Charret asking if that type of program exists for suicide attempts. Dr. Seguin. Yes. Madame Charret, thank you for your question. It's very delicate because death by suicide is generally public, but the attempt is private. So it's very delicate because if a child, a youth, or an adult attempts suicide, should we roll out a program because there has been a suicide attempt? It's not information we're at liberty to publicize. So generally, no, there are no programs for suicide attempts. However, the ability to screen youth to see, for instance, if some youth are directly impacted by this attempt, then we would look at intervening very individually for the people that are surrounding the individual that would have made an attempt. Jean-Michel Mercier. Yes, and that ties in nicely to Isabelle Côté's question. So we should prefer individual meetings and not group meetings, for instance, a class in a school. Dr. Seguin, yes, in fact, literature shows that everyone is affected the same way. So asking 25 or 30 youth how do they feel about something, it creates a further level of stress, and it creates a blur of information. So it has a negative impact. So the best thing would be to say, if there has been a death by suicide, the best thing to say is, for instance, there won't be an exam today. We'll use this time to read. If some of you need to meet a social worker, a nurse, a psychologist, come see me, and then we can intervene. We don't look at a group intervention. The best thing is to contain emotions, to be supportive, to say we'll have time to reflect. You can, for instance, write down how you're feeling. You can use this time. So it's better to do this than to do group interventions. That said, we may have an intervention with 2 or 3 individuals at a time, but not a larger group. Jean-Michel Mercier, thank you. Now it's almost 1 p.m. Therefore, what I would ask, I know that some of you were asking questions, for instance, what are the major differences with the former Postvention program? Please send me your questions, and I'll send them to Dr. Seguin, and we'll try and find an answer for you. Once again, the program is available on the website, and the recording will be made available.